Now, when it comes to rolling vaccines out to all seniors over 80 in Ontario, we noted earlier how there's a plan, but it involves 34 separate plans, one for each regional public health authority in the province, a very decentralized approach. So let's try to understand what that means exactly with the help of Dr. Isaac Bogoch, who is a member of Ontario's Vaccine Distribution Task Force, which means, Dr. Bogoch, you don't make policy, but your expertise certainly informs how the government then decides these kinds of things. So 34 regional health units coming up with their own plans. Why was that the best way to approach this?
Yeah, well, for starters, there is a common playbook. There is a common set of rules that all the 34 public health units are playing by. But of course, public health is local, and they really have to find the best ways to vaccinate those that they represent. So, for example, a vaccination program for Kenora might look a little bit different than a vaccination program for Peel. Different populations, different geographies. And of course, the local public health knowledge is invaluable. Still, there's going to be more similarities than differences. Everyone's going to have mass vaccine sites. Everyone's going to have community centers that are vaccinating. People are going to have primary care and pharmacies vaccinating. Most units are going to have mobile trucks to help with underserviced and homeless populations. So there's going to be more similarities than differences.
But there is a disadvantage, though, right? Like this is sort of the definition of a patchwork approach. So if seniors in different regions get different access or go to different places for information, does that risk getting complicated?
Well, there actually is a common source of information, and that is the provincial website. And the provincial website for vaccination will have all the information on how people can sign up when the time comes and point them in the right direction. So by pointing people to the exact same source for information, people will have a good understanding of how they can get vaccinated, when they can get vaccinated, and how they'll be prioritized.
Okay, we'll be watching. Always good to have you on the program. Dr. Bogoch, thanks for your time.
My pleasure.